Hello, my name is Heather Schrader, and I'm the Vice President and Chief Nursing Officer of Aurora Baycare Medical Center. I want to first thank you for choosing healthcare as your profession of choice. As a student, building trust with your peers, instructors, and all members of the healthcare team, including the patients, is critical to your success. As part of communication skills, both verbal and nonverbal communication is important to building that trust as well as establishing positive patient outcomes. For your success, I've identified 5 communication skills that you should be using in your daily practice. These 5 consist of acknowledging, introduction, duration, explanation, and thank you. Let's begin with acknowledging others. This is that very first impression. That first impression that builds trust and confidence that the patients and others in the healthcare team will have with you. How do you build trust? With acknowledgement. Well, this means walking in with a smile. And not only smiling, but acknowledging the individuals by their first and last name. It's also an opportunity to ask others how they'd like to be acknowledged in future interactions. This is also important to look at the surroundings of your environment to understand who also is present and acknowledging each and every individual using positive eye contact. It's important to recognize your tone and your body language match the words that you say. The second is thinking about the introduction of you. This is that opportunity to build trust and build confidence that others have in you. This starts with your introduction of who you are and what your role is. It's also important to introduce anybody that is present with you at the same time. This is an opportunity to use a positive demeanor and let others know that you are not rushed or in a hurry. So it's important that they always understand that they are the most important person that you are with at that very moment. When we think about duration, this is about timing, managing that timing of expectations. This means estimating how much time you'll be spending with an individual so that they too can recognize how much time that they will have to be spending. This could mean for a patient, when they have family members that are coming, it's good for them to know exactly how long you're going to be with them. It allows people the opportunity to maybe take a break before you begin. In addition, it's important to always remember not to use slang language or patronizing terms. Explanation is extremely important because everyone needs to know exactly what it is you're going to be doing with them and how much time you're going to be spending with them. Explanation is about understanding what someone needs to know and what exactly it is that's going to be done. It's a time for you to ask them questions, understand exactly what they need to know, and this might be even asking individuals to repeat back exactly the things that you have described so that you then know whether or not they understand everything that's going to be happening. It's important to make sure everyone in the room or present understands the next steps that will be taken. When we think about explanation, we then move on to what we call thank you. Each and every time you end care of a patient or working with coworkers or peers, it's important to always thank you. This is that opportunity to be able to say, thank you for giving me that time. It's also that opportunity to say, you're important. Never leave without asking one particular question. And that question is always, is there anything else I can do for you? Because I have time. Utilizing these 5 key communication skills is critical in the healthcare field. It's critical because it actually helps provide positive patient outcomes. It opens that line of communication so that everybody understands exactly what is going to happen in the next steps. I welcome and thank you on your journey towards being a positive, excellent healthcare worker. Thank you.